I'm Marlene Cole. I'm a program officer at First 5 LA and the co-lead, along with Jocelyn Gaitan from Department of Public Health of the Referrals Workgroup. We are joined today by the fabulous policy team at LA Best Babies Network, Anna Gukassian, Laurel Maury, and Lynette Marquez. Thank you so much for being here with us. Could you please advance to the next slide? Thank you. So I just want to tell you a little bit about the Home Visiting Consortium, as well as about the Referrals Workgroup of the Consortium. So the Consortium brings together more than 60 home visiting programs, family and child health organizations, and community partners. Together, we strengthen LA County's home visiting system through shared training and resources, research and data collection, to improve referral pathways and advocacy and policies that recognize the vital role of home visiting services. And our mission is to convene and coordinate organizations to strengthen collective capacity around advancing racial equity, centering family voice, sustaining quality practices, influencing policy, and growing funding so that all expectant and parenting individuals have access to support, and LA County's children are healthy, safe, and ready to learn. And if you'd like more information on the webinar, on the Home Visiting Consortium, please go ahead and scan the QR code there on the screen. And I want to tell you a little bit about, I'll introduce the panelists in a moment, but first I want to share what led the Referrals Workgroup to organize this panel. Our work group is one of several in the consortium, and our purpose is to support member organizations, home visiting staff, and service providers to strengthen pathways and linkages for families to the community resources that they need and the home visiting program that is the best fit for them, and to advocate for systemic improvements to eligibility and access. And as many of you know, probably as participants in those surveys, every other year we conduct an online survey of the home visiting network, of the home visitors within our network, rather, to learn about the barriers that they experience when attempting to refer clients for needed resources and services. And referring clients to mental health care has consistently been one of the top 3 types of service barriers, along with housing and childcare. So our goal today is to share resources to help you address this barrier. With that, I'd like to review the objectives for today's webinar. Oh, okay, and some important info before we get there. The webinar is being recorded, and all the recording and all the materials will be sent in a follow-up email, and all trainings are posted on LA Best Babies Network website. So submit your questions as we move along. Feel free to drop them in the in the Q&A rather, and complete the survey at the end because your feedback is important to us. And can we just advance the objectives, and then I'll go ahead and introduce the presenters. Thank you. So our objectives today are to learn about available perinatal and family mental health services. We'd like to make sure that you understand what referral pathways and eligibility criteria, and identify strategies to support families experiencing barriers to accessing mental health services, and also to help you gain practical tips to navigate mental health systems and manage care plans. We'd also like to, build upon home visitors' existing referral expertise. We know that you have a lot of information, but we also will, during this presentation and after, share tools, directories, and strategies to help home visitors identify appropriate providers and address, overcoming common barriers. Okay. And now I'd like to introduce our panelists. So we have from the LA County Department of Mental Health, Infant Mental Health, and Perinatal Health Referral Network, Dr. Veronica Chavez, Dr. Evelyn Espinoza, and Alicia Manning. We have from Bright Life Kids, Adriana DeFranco, excuse me. We have from Jewish Family Services Los Angeles, New Parents Connect, Melanie Weiner. And we have from Maternal Mental Health Now, Alex Vialba. And from Help Me Grow LA, we have Lizeth Martinez and Diana Casillas. So each one of our panelists is going to spend about 8 minutes presenting on their programs. They're going to give you kind of a high level overview of what they do, what happens. And then at the end of that, we will, we have some preset questions that we, as a referrals work group, thought were important, and as well as, things that have come up from home visiting providers that they've shared with us. So we'll go through those questions, but we'll also be periodically checking the Q&A and trying to address those questions as well. So with that, I am going to turn it over to the DMH team to provide their presentation. Thank you.
Hi, good morning, everyone. My name is Alicia Manning. I am a licensed clinical social worker with the Department of Mental Health, Family and Community Partnerships, and I work in the Parental Perinatal Mental Health Program. And I'll turn it over to my colleague, Dr. Espinoza, to introduce herself.
Hi, good morning, everybody. My name is Dr. Evelyn Espinoza. I am a licensed clinical psychologist and an infant, family, and early mental health specialist. I sit on both the Birth to Five team and on the perinatal mental health team. And I will hand it over to my colleague and friend, Dr. Chavez.
Thank you, Dr. Espinosa. Good morning, everyone. This is Dr. Veronica Chavez. I am a supervising psychologist with the Access Helpline, the entry point into the Department of Mental Health system. And I'll be talking a little bit about that as we go through today. But I'll go ahead and turn it back over to Alicia to get us started. Thank you.
Thank you. So we're going to start off by just talking a little bit about what LA County Department of Mental Health is. So we serve a wide range of demographics ranging from children, so transitional aged youth, families, adults, and older adults. So although we have a broad reach, we understand that for our perinatal mental health, for our perinatal individuals, we do have a gap. And so basically what our program, Parental Perinatal Mental Health, has been doing, we've been working to bridge that gap by equipping providers with specialized training so they can better serve the vulnerable population. And if I can have the next slide, please. Looking at our current landscape, so we have 38 directly operated adult clinics, 8 directly operated children clinics, and then we have 13 maternal mental health champions. So those are individuals that have been identified across the service areas, all eight service areas, that can provide information regarding maternal mental health, as well as we have champions that provides guidance to the maternal mental health champions. We also have the Fatherhood Initiative that has been in effect for a couple of years now, because we understand not only do the birthing person need support, but also partners and non-birthing individuals as well. So the Fatherhood Initiative was created to kind of support in that area. And then our current maternal mental health programs, we have one in Service Area 1, the maternal mental health program. So that is Antelope Valley. And then Service Area 7, there is a full service partnership mothers and babies program for individuals that need additional added support outside of them coming to the clinic. There are individuals that will go to them and provide them services in the field. And if I could have the next slide, I'll turn it over to Dr. Espinoza so she could talk about the birth services.
Thank you so much, Alicia. So, for the Birth to Five program, our goal is to support children and their caregivers from newborn up to age 5. And the way that we do that is we actually have some core competencies. We have diagnosing, so the 0 to 3, DC 0 to 5 training. We also have best practices, typical and atypical development. We also have the growing brain, but on top of the growing brain, we also have brain development and trauma. And we provide these monthly. Not every single one of our trainings gets provided monthly, but we roll them out throughout the whole year so our clinicians can actually sign up for these trainings. On top of that, we also have a monthly Birth to Five collaborative with different topics and different themes. I believe last month we talked about the neurorelational model by Dr. Connie Lillis. In the future, we're going to talk about the impact of trauma in children. And Dr. Jessica Thomas actually does a really wonderful job where she has all 12 months already planned out. So she already has all of 2026 planned. And the extra support that we offer, and that is open for everybody. The Birth to Five Collaborative, you just have to sign up. If you aren't part of Dr. Thomas's listserv, I would strongly recommend that you do that. And she actually sends out the QR code monthly, sending out several reminders of when it opens and when it's about to close so you can get in for those trainings or workshops, I should say. And the other thing that we do monthly is we have a Birth to Five consultation call that is open to everyone. We actually encourage people to come in and consult with some of the subject matter experts on the team to discuss their cases, where we also at the very end share our resources page or share all our resources with one another so that we can actually provide anyone who is supporting families in the Birth to Five community.
And I'll quickly talk about our parental perinatal mental health program, which is going to mimic what the Birth to Five services look like, where we will be offering support to providers so that they feel they are equipped with the tools that they need to provide care, as well as providing consultation calls and support not only to providers but also to caregivers who are adjusting to their roles as take caregivers, as well as just continuing to support um, providing education as it relates to perinatal mood and anxiety conditions. And if I could have the next slide. I just want to quickly point out that we are building a directory for perinatal mental health. So this here is a list of clinics that have providers that have been trained in perinatal mental health. So the evidence-based practice that we endorse here at BMH is mothers and babies, and then we also have our staff members trained in Love Dad, which not only promotes supporting non-birthing individuals, but also families. So I believe you guys will get a copy of this slide so that you'll have this directly of the clinics that are currently that clinics that currently have mental health providers.
And I will pick up here showing a little bit about the LA County Helpline for Mental Health and Substance Use Services. This is what a caller can expect when they call in to the 800-854-7771 number. There is availability of the 13 threshold languages that callers will be able to hear upon calling in. And then, as you can see here in the phone tree, then for a crisis or a mental health referral, you would press 1. And then that leads into a subsequent sort of menu of options as well. One for a crisis, this is if an individual is in need of a field response teams to go out and assess with the possibility of recommending a hospitalization for stabilization. And also we provide information, general information about mental health referrals. We can also provide the referral directly to any of the contracted and directly operated clinics that are under the Department of Mental Health. And then we also have a team of agents who explicitly provide emotional support. So this would be somebody who's calling in. They don't necessarily want somebody to come out and assess for possible hospitalization, but they want to speak to somebody. And that's important, again, to process what is going on. It could result in possibly a team going out, or it might not. This is, again, a group of agents that are specially trained to provide emotional support for our community members calling into the Access Helpline. Next slide, please. Thank you. And this provides, again, a little bit more information about the Access Helpline. We have been integrated with the Department of Public Health Substance Use Services line as well. And again, the mission is really to provide our consumers with empathetic, compassionate, and timely mental health services. This is the entry point into our mental health system. And I would encourage, again, even if it's if you're unsure about the services that are provided, call us. We can do our best to help you. If we do not have the answer, we will connect you with somebody who will be able to provide support and services as well. The Access Helpline is open 24/7, 365 days a year. Holidays, there's always coverage. We have shifts that can provide coverage, on a 24-hour basis as well. As I mentioned, again, we provide services related to just kind of general information, but also referral services to any of our contracted and directly operated clinics, emotional support that I spoke about a little bit. And then in terms of the dispatching of psychiatric mobile response teams for anybody who's in a crisis and who needs additional support with the possibility of hospitalization. Again, there is after-hour support, there's telephone interpretation, and there are more services that we're gearing to provide so that it is a lot more of a friendly sort of entry into a system that is so huge and vast that it can sometimes be very off-putting. But again, that number, I would encourage you to call as needed, share it widely with your family members as well. There are, I will say, I know I'm running short time, but I will say that when the referral comes into our system, we do have specific sort of requirements to respond and provide that service, or at least connect with the individual within 5 business days, 2 to 5 business days if it's upon psychiatric discharge, and 10 business days for a sort of more of a routine referral. But again, our goal is always to be able to get people in to be seen as soon as possible, because we understand that suffering can encompass a whole individual's life, and we want to be as apt as possible to provide services. So that will be all for now. For my end, I'll turn it back over to Alicia if we go on to the last slide.
Thank you. And this is our contact information, so you can scan the QR code. The one on the left is for our Birth to 5 network. So you can scan that QR code to be placed on the email distribution list. Through that email, we send out a lot of different information as well as different trainings. And then for the one on the right, the parental perinatal mental health, that is how you can join our network, where we can also give you different information as well as we send out different trainings and things as well. So thank you so much for your time.
Thank you. And we really appreciate that. We're going to hand it over to Adriana DeFranco from Bright Life Kids, who's going to share more about their program.
Thank you, Marlene. Good morning. My name is Adriana DeFranco. I am a community engagement manager at Bright Life Kids, and today it is my honor, my privilege to share with all of you about our new CowHope program. Next slide, please. So Bright Life Kids, it is a CowHope program. We're powered by a company called Brightline, but we're funded by the state of California. We offer free behavioral health coaching to all California families with kids age 0 to 12, and I'll explain more what coaching means. So before we start, just important that we are state funded, and for that reason, we are free for every California family. The state has 2 programs under the same California Children and Youth Behavioral Health Initiative, and we are Bright Life Kids, supporting the kids 0 to 12. And the state also has a program called Soluna. Soluna supports the 13 to 25. So both programs under the Department of Healthcare Services. To talk a little bit more about accessibility of our program, right? So I already mentioned we're free, but more than free, we don't ask for insurance verification. We don't ask for income verification. The family does not need a referral to use our services, and we never check immigration status. The only qualifying factor is a zip code in the state of California. So this is a very easy and open door, let's say like this, service to all California families. We're not checking more than your zip code. We do have coaches that are bilingual. They speak English and Spanish. Families can choose a bilingual coach. Most of them are Latinos as well, so they understand our communities. And for the other languages, we do offer live translation. What does it mean is that during the coaching sessions, and these are all virtual sessions, or one-on-one sessions, the family can request a translator, and we'll offer that for them. Families can sign up on our website, or they can download our app if they prefer that. And in terms of availability, the services are available coaches from Monday to Friday, from 9 a.m. to 8 p.m. So for the working parents out there that might need evening sessions, we offer that. And other than the opportunity to have the virtual Zoom coaching session, the families can also chat with our coaches. So we offer different ways for your families to access our services. Getting started is simple. All a family has to do is go to our website. They're gonna create an account. The same way they create an Amazon account, a Netflix account, right? We all do that. What do we need is an email and a password. Only these 2 things will create their account. After that, there is a quick assessment. It is a 2 to 3 minutes assessment that families will complete, and that helps us offer them the best coach that can fit and support their needs. The coach, as I said, is virtual, and once the family signs up, they can choose the coach that best represents them. They can read the coach bio, they can see the coach picture, and they can make their own appointment. All quickly, all easy. In around 5 minutes, when I'm tabling, I'm supporting families on the field, I'm able to register them, and we schedule the session. Availability for the sessions are usually for next week, so we don't have a waiting list. Next slide, please. So now what do families get when they sign to Bright Life Kids, right? So the most exciting part is the coaching. And what we're talking here about coaching is prevention and early intervention. Our coach sessions, our coaches can help the families navigate day-to-day issues. For example, the little ones, the tantrums, emotional development, emotional regulation, sleeping patterns, disruptive behaviors in classroom. For the older kids, we can start helping with navigating friendship, self-esteem, bullying. So the coaches, they help the families create goals. They give the families step by step a plan so that they can support the children. And whatever the issues that are happening on their lives. So that's one, coaching. The second thing, we have a digital library that families can reach out. They can read any article that they want. They can watch a video. Some families like to do this on their own time. We also have a care coordination team. Our care coordination team can support families making referrals for services outside Bright Life Kids. So let's say a family comes to us and they need therapy, right? And we are offering coaching. So if they do need these higher services, our care coordination team will make a referral for the family for services outside Bright Life Kids. We can also support them with other needs, for example, food insecurity, maybe finding childcare. Our care coordination team will help families navigate resources if they need that support. And the last thing we offer are our Bright Life Kids communities. And these are digital peer communities where families can drop in if they're not ready for coaching. They can just drop in there. They can meet another family. They can ask a question. So we have a lot of ways that family can use our services. When they're ready, they will make their choices. And this is just an example. How do we fit into the care delivery model? On the top of the pyramid, we have the therapy, right? The physicians, and that's not us. What we're coming here to offer for the families at the bottom of the pyramid, where most families are, with prevention and early intervention. I already mentioned some of the things, right? The tantrums, emotional regulation, sleep concerns. These are just examples. The truth is the family will come to us and bring, right, what's happening with them. And our coaches will offer support, will help them navigate whatever is happening with them. Next slide, please. So a little bit of the differentiation between coaching and therapy, right? Coaching is a 30-minute session, prevention, early intervention, helping families navigate day-to-day issues. Therapy, right? We're thinking about more complex and chronic concerns. These are 60-minute sessions. As I mentioned, we do coaching. And if the family needs therapy, we can refer them out. And if you're in doubt, if you're not sure, just refer the families to us. We'll take care of everything else. Next slide, please. We serve families with kids 0 to 12. For the little kids 0 to 6, the sessions are for the parents. It's parent management training sessions. For the older kids, 6 to 12, the kids can also do sessions. And sessions can be families together, only the parent, or only the older child. That's a decision that parents and coaches will make. Next slide, please. Who are our coaches? So our coaches, they're not therapists. They have a master's degree in a health-related field or a bachelor's degree. They come with coaching certifications that you see on the screen. There's 2 certifications that we accept. They have more than 5 years of direct experience working with children, youth, and families. We do an extensive background check on them, and then we train them for another 80 hours. As I had mentioned, families are the ones choosing the coaches that they want, right? So we offer coaches from diverse background and diverse also training and lived experience. Next slide, please. We're going to skip that for now because we already talked about coaching and chat. Next slide. We have the library tools. Next slide. We have the care coordination team. Next slide. And we have our communities. Next slide. Thank you. So we're almost done here. How you make a referral. You can refer a family to us. We do have a link. If we send a referral to us, we will email your family. So just that to keep in mind. The best way to support your family is just to give the flyer to them, to give the information to them. But if you want to make a referral, we're going to have this link for you all later on. Next slide, please. And I'm going to skip that. That was just a mom sharing how we can support them. Let's keep that as well. I'm on time. We have monthly webinars. Our next webinar, we're going to be talking about summer digital wellness. These webinars are always open for families and staff. And we welcome you all to share with your families and sign up for our next webinar. And I think we're going to skip that because I know I am on my time. I don't want to take too much time from everybody. So we're Herbalife Kids. We do 0 to 12. We also have Soluna. We're in the same umbrella, Survey 13 to 25. And I think we have my last slide. Yes, this is our last slide. If you want to do a sneak peek, if you want to learn about our services, we can go here. We have served more than 350,000 children through the state of California. And this is all because all of you have been sharing us. We love you all. We appreciate the support. And I thank you. Thank you very much.
Wonderful. Thank you, Adriana. I'm happy to introduce Melanie Weiner from New Parents Connect, support for new and expecting parents, and from Jewish Family Services LA. So welcome, Melanie.
Thank you. And thank you to Bright Life Kids and DMH. I've worked closely with all of you. So I am Melanie Weiner. Sorry, Marlene. I am a licensed marriage and family therapist and a PMHC, and I oversee New Parents Connect, which is part of our early childhood division at Jewish Family Service Los Angeles. So New Parents Connect, we've been around for 19 years, but we expanded 6 years ago with the creation of our early childhood division at Jewish Family Service, a very exciting thing for us, in which Raising Baby, our virtual home visiting program, came into existence, and we have been integrating ever since. So we are New Parent. We're our flagship offering. Our main offering is groups. And for new and expectant parents at risk of or experiencing perinatal mood and anxiety disorders, also called PMADS. Next slide, please. So approximately 1 in 6 mothers, 1 in 10 fathers experience a perinatal mood or anxiety disorder. And I'm going to define that a little bit. It can include depression, anxiety, OCD, bipolar disorder, and in rare cases, postpartum psychosis, and symptoms, which probably many of you are familiar with, but, depression, anxiety, irritability, sometimes anger, difficulty bonding, sometimes isolation, guilt, shame, partner conflict, birth trauma, health issues for the child, NICU stays, breastfeeding challenges, lack of support. So that's what we see. And if left untreated, the good news is that PMADs respond really well to intervention, and that groups and therapy, mental health intervention, are really effective, as is home visiting support, reducing isolation and shame. Left untreated, there's a risk of chronic depression, anxiety, or just missing, things like bipolar disorder, not treating OCD. For fathers, the risk of depression goes up by 50% if the mother has a PMAD. The biggest risk, perhaps, is maternal suicide. That can also co-occur with substance use disorders, but maternal suicide is a very serious risk. And, parental confidence, lowered parental confidence, feelings of unworthiness and shame. Next slide, please. So eligibility. I love the way that Adriana did it, but basically anybody, we have no barriers to entry except for being pregnant or pretty much within a year postpartum, with some exceptions. Experiencing really any challenges, wanting to reduce isolation. But this is a place to talk about difficult things, as opposed to, if you really want to talk about just, get parental advice. in a different kind of way. There's plenty of groups for that. This is a place where people come to be vulnerable and to open up. It's open to all Los Angeles County residents. It's free. The one caveat is New Parents Connect does not have Spanish speaking only monolingual capacity. Raising Baby does. New Parents Connect does not. But other than that, anybody is welcome, regardless of immigration status or any other criteria. So what we do, so as I said, groups are really our big offering. We have postpartum support groups for new mothers and new fathers, and we also have pregnancy support groups. But I would say postpartum support is our mainstay. We run up to 3 groups at a time. We're continuously starting them because of demand. They last about 22 weeks when people really start returning to work and have more trouble attending. Our father groups have really been growing. We also offer some off-the-record free counseling for people that are having difficulty navigating systems or can't access, a specialist, somebody who specializes in perinatal mental health. I do want to say about groups that they are a place where people are really acculturated by our facilitators to be vulnerable and to feel safe. We're there to keep things, going the way that they're supposed to, the therapist in the group, the facilitator, but it's really the parents who connect with each other and they offer each other empathy and support. It's very normalizing. It really reduces isolation. Very powerful experience from what we witness and what we hear. Next slide, please. So here's our contact information, which I know you're going to receive with the follow-up from our coordinators here. But we have a webpage. You can search New Parents Connect, Jewish Family Service Los Angeles in Google. A lot of people find us through search engines. You can also just email newparentsconnect@jfsla.org. All right. Next slide, please. Thank you. So, okay, I want to talk a little bit. I saved some space to talk about our collaboration with our own Raising Baby program, which is our sister program within our early childhood division. As an example of how a home visiting program can be perinatal mental health informed. Next slide, please. So Raising Baby is our free 3-year-long virtual home visiting program. Like New Parents Connect, it's open across LA County with no eligibility criteria. We do have Spanish-speaking monolingual capacity, no checking of insurance, no income qualifiers, no immigration status barriers. People need to be in their 3rd trimester of pregnancy, but this is a program that follows people for 3 years. Next slide, please. Raising Baby, what's sort of interesting about us is that each parent and family, each family or parent, depending on the system, gets a team that's comprised of a parent coach and a therapist. So we have a clinical lens for all of our families, but so we can kind of toggle between mental health and hands-on coaching centered on child development and teaching parents to play with children, all of the things that home visiting programs do, which you guys are all familiar with, case management. We also offer groups and all of our programs also promote in-person connection. So that's Raising Baby. So last slide, please. So I want to tell a story about collaboration. I also do want to say that we, in New Parents Connect, we get people on a WhatsApp chat and we try to launch them when the groups close into peer-led groups. And we're seeing increasing success with that because we want them to continue to be, to know each other over the course of their children's, to become really close with each other and continue to support each other. So this is a story of collaborating between New Parents Connect and Raising Baby. This is a very complex and really sort of a not everyday example, but I think it's a good illustration. We had a family where the mom came in from Cedar Sinai, referred to Raising Baby for home visiting. And then the dad came into New Parents Connect, referred by Postpartum Support International. They came in separately. The mom had experienced an episode of postpartum psychosis, which is very rare. Luckily, she was not suicidal and it was not dangerous for the baby, but she had left the baby somewhere and wandered off and couldn't remember where she was or who she was. DCFS did get involved. The baby remained with the father as the caregiver, but it was all very overwhelming for them. And our first task was to come together and get them together as a family without violating confidentiality laws. So that was a little bit tricky, but we did that. And then to start to work with them together to help them understand the mental health condition and how to advocate for themselves and how to get the treatment that was needed for the mother, and also to support them with their child's development, with their case management needs, and also with Department of Child and Family Services. We had an excellent collaboration with DCFS, also helping them understand the situation. The mother did end up being hospitalized again when she got pregnant again with psychosis, and she eventually got a diagnosis of bipolar disorder, but we were able to really help her understand what was going on and to support the family. And we felt really honored and privileged to be able to do that. So I will conclude there. Thank you so much for letting me share.
Thank you so much, Melanie. We really appreciate your presentation and the services that JFS offers. I'm going to now introduce the team from Help Me Grow LA, Lizeth Martinez and Diana Casillas. Thank you for joining us.
Thank you, Marlene. Hi, everyone. Good morning. Thank you all for being here. I am Lizeth Martinez, licensed clinical social worker. And here I also have my partner, Diana Casillas, who will be introduced shortly. And we're Help Me Grow LA. Diana. Oh, you're muted, Diana.
Sorry about that. So what I'm going to do is I'm just going to give a really quick overview of Help Me Grow LA, and then I'll hand it over back to Lizette for the mental health component. Help Me Grow LA is a program that helps connect families to services that support the child's healthy development. And what this means is that we meet the family where they're at and help guide them when they have questions or concerns about their child. And what this looks like is early intervention information, especially for parents who may not know what services are available or how to access them. We also offer guidance where there's developmental concerns, helping families understand what to look for and what steps they can take next. Our team of family partners also help with care coordination and referrals, meaning that we don't just give the information out, but we actively help connect families to the right services, whether that's regional center or any type of therapy or any other community resource. And then we help provide parent education and support, helping caregivers feel more confident in understanding and advocating for their child's needs. Help Me Grow doesn't provide a direct service, so those parent education would be through our website or PDFs or referring out to advocacy groups or trainings and workshops. And finally, we do help ensure that children are receiving developmental screenings, which of course are a key part of identifying any kind of delay and getting any support as soon as possible. Our family partners are able to do these developmental screenings over the phone with families. Next slide, please. Oh. The Help Me Grow LA primarily focuses on children, which are 0 to 5. But we do help families with children of all ages. We won't turn any family away because the child isn't between that 0 to 5. But 0 to 5, those are those critical developmental years. And so that is our main focus. We do serve all of Los Angeles County, and our services are completely free. There are no income requirements and no need for medical insurance. We also are available in all languages by the use of the interpreter line. This ensures that all families can access our support in the language that they're most comfortable with. And we don't ask, of course, any questions about immigration. Our goal is to create a safe and welcoming space where families feel comfortable reaching out for help. Our families can reach us either through our online referral, or they can give us a call at our call center, and they will be connected to a family partner who is someone with a lived experience who understands the whole system of care. And everything we do is family needs based, which means we tailor all of their support to each family's unique situation, and we don't consider it all a one size fits all approach.
So I apologize beforehand because I've seen that our slides have been traveling while they're sleeping. I see the numbers everywhere and everything has been shifted. So
Oh no.
apologies on that. So we have Help Me Grow LA is ran by a family partner team. It consists of family partners that Diana mentioned. They have lived experience, so meaning they have a child with a disability or a special need, and they have, mastered in a way how to navigate the resources, how to navigate, the needs of the child and the challenges that are out there. We have a family partner assigned to each service spa. Currently, right now, we have five, and we're hoping to fill service area 3 and 6, but our goal is to have those quickly to continue servicing all of our service area families. So when a family or a provider contacts us through the call center, our family partners engage the families or providers in a navigation call. That means they go through a small assessment, exploring what their needs are. Based on that, they connect them to the resources, and they also coach them, specifically the family and the caregivers. They coach them on what steps to take, who should they call, what questions to ask, to make this engagement more successful. After a few weeks and after the first call, our family partners actually sent a very descriptive letter of the themes and the questions and everything that was discussed during the first call. And this letter entails of, again, the details of it, contact information, phone numbers. Our family partners really put hard in detail into this letter. And after this letter, within the first call, then they do a follow-up call. In this follow-up call, they explore barriers, they explore concerns, they explore success rate of following up with these calls. And from there, they continue to follow up with the families as long as the family needs. So going back to family needs, right? So the family only needs support for that first call, and after the follow-up call, they're like, "I'm good. I reached to everybody, and I can take it from here." Then our family partner will close that case, but sometimes they continue to work with family for after 4 follow-up calls and or even more. And then families do call us back, and we continue to support them. There's no turning them around. So next slide, please. So I'm the mental health consultant here at Help Me Grow LA, and the reason that I'm here essentially as a mental health consultant at Help Me Grow LA is because there was Help Me Grow LA received a crisis call about a year or 2 years ago, where a mom called the center and was asking, "What do I do? My child is, presented with a list of different concerns for the child, behavioral concerns," and our Help Me Grow LA team didn't know what to do. And so now, as my role here, I'm here to support families during these moments of crisis. When they reach out to us, I'm able to redirect them, to provide that space to regulate ourselves in this call, support them in understanding the current behaviors, and also supporting them in understanding, diagnosis of autism. Perhaps a lot of parents do call and they're taken aback in this news of your child has a diagnosis of autism, right? How do they navigate that? And so I'm here to provide that space and support. So our family partners will refer the parents to me. We go through a consultation, and our consultations are very brief, but also right as needed. And then we discuss referrals to the appropriate, perhaps mental health services, as well as appropriate, evidence-based practice that perhaps this family could benefit from. We provide, I provide stress reduction skills to the parents that call and also provide community presentations. And I continue in stay collaborating with outside agencies as well as through partners and DMH. Next slide, please.
I wanted to add a little bit to what Lizette just mentioned. Sometimes when our family partners get a call, it's the first time that parents are dealing with a diagnosis, and it's very lonely for them, and they're very overwhelmed. And so because of that, we felt the need to incorporate a mental health consultant so that they can have access to her right away. And she can help them kind of walk through that process. Our family partners, as Lizette mentioned, are also parents with children with special needs. So they are able to talk to those parents as a parent, right, who has gone through that same I don't know, sometimes it's kind of a shock, which is the word that some parents have used. But we did really feel the need to have a mental health consultant who's able to not just talk to the parents at that moment, but also to be able to give them tools to work with during this whole process. So that's why we incorporated mental health consultant into Help Me Grow. I'm kind of lost. Can you hear me? Still hear me? Okay. Okay. So when would someone reach out to Help Me Grow? So if a child screens positive for a developmental delay, please refer them to Help Me Grow. Our family partners will do the navigation, call with them, and then help find the right resources that are in their community. If a child misses a milestone, or even if a parent just has questions or a concern, they can send them over to us and we will have that navigation call with them and we will find the most appropriate resource for that family. Next slide, please. And the way to get the quickest way to get to us is to give us a call at 833-903-3972. That goes to our call center, and we have 5 family partners on the line ready to talk to parents. If if there's language is Spanish, then we do have bilingual family partner. But if they have another language that they would prefer to have a conversation in, we can use our interpreter line and talk to the parent in that way. We also have a referral form on our website, and you just click on connect, you fill out the form. It's very quick. We just ask for the parent's name or the caregiver's name, a phone number where we can reach them, and a time and date that they would like for us to call them back, and our family partners will call them back within 48 hours. Next slide. And that is all. Thank you so much. If anybody has any questions later on, we'd be happy to answer them.
Thank you so much, Deanna and Lizette. Really appreciate your presentation. A lot of really helpful information. We know that our home visiting programs, it's a challenging thing for parents to kind of suspect that their children have a developmental issue, and to know that you're there as a resource and support is wonderful. And now I'd like to invite Alex Villalba from Maternal Mental Health Now. We've been working with this organization for a long time in our consortium, and they've been an active participant of our referrals work group. So we're really excited to invite Alex to present on their program. Thanks, Alex.
Thank you. Hello, everyone. I will just hop right in. I love everyone's presentations are so detailed. Mine is not as detailed. I hope that's okay. So a little bit about Maternal Mental Health Now. We are an organization. We've been around for 19 years. Our mission is to remove the barriers to the prevention, screening, and treatment of perinatal mood and anxiety disorders in Los Angeles County. We historically are an organization that has worked in training providers specifically on how to better screen and treat PMADs, as Melanie had kind of gotten into a little bit earlier in her presentation. But as of 3 years ago, we switched over to direct services. So next slide, please. We go back one. There you go. The flyer, please. Thank you. Beautiful. Our program, Sana Sana, is a warm line for folks in the perinatal period. So, by warm line, I want to be very clear on this. We are available Monday through Friday from 9 to 5. So, what a warm line is and how it's different from what you may understand as a hotline is if folks call, text, or email us, we, for the most part, won't respond immediately on the second or third ring. We will get a phone call if we're in another meeting. For example, I've gotten 2 phone calls, and while we've been in this webinar, I'll call them back later today and schedule an appointment for them, hopefully tomorrow or after when they are available. So we are not a crisis program, but we help folks with mild to moderate mental health concerns. So say someone is, and by perinatal period, maybe I should back up a little bit. Perinatal period is anyone who is thinking of conceiving all the way through, we say 2 years postpartum, but we work with folks who have young children as well, because we know if those mental health issues don't get addressed in that 2 year postpartum period, you definitely see those 5, 10 years down the line. So we are very loose in term when we say that. Parents, we don't have a hard deadline of, oh, you have a 2 year old, we can't serve you anymore. If you need support, come to us and we'll work with you the best we can. So say someone's going through the fertility journey and they just have some questions, very similar to a doula. If they just want some education on the fertility process, they can give us a call, and we'll do our best to answer those questions that they may have. We're a team of 5 certified peer supporters. Each of us have our own areas of specialty. I'm a prison doula. I speak Spanish. I work a lot with young parents, specifically who are still considered minors. And we have our wellness coordinator is a yoga instructor, so she leads families a lot in somatic practices, which folks find really helpful. And our newest peer supporter is a big advocate for the disability community, and we're hoping to hopefully by the summer launch our other support group for neurodivergent families. I'm gonna go into those a little bit more, but our program, Sana Sana, you can call, text, or email us if you have a client. They can do it directly, or you as a provider or someone, if you're related to the client, you don't have to be a provider, it could be a family member, a loved one to the client, can refer us directly to us, and we will have the referral link for you here soon. Next slide, please. So access, referrals, and engagement. We have no wait lists for initial connection. I think that's something that is really appealing to a lot of folks. So if they want one-on-one support, again, they can call, text, or email us. And while we're not a hotline, we'll get back to them within 1 to 2 business days, which is a very quick turnaround. Oftentimes folks come to us while they're waiting. So say they are waiting to get off the wait list, or they're waiting to see a therapist, a clinician. We provide non-clinical support. So if they're waiting to meet with a clinician, we can set up one-on-one meetings with them, 45 minutes, an hour, once a week, set up a care plan with them, a non-clinical care plan, where again, we can guide them through somatics, provide information, or just if they need someone to talk to. Often folks just need to be heard. And so oftentimes that's why they'll call us. And that, this is while they're waiting to get their clinical support, or we're in addition to their care team, their broader care team. We offer resource referrals. So a lot of folks come to us, they just need diapers. They'll text us, hey, do y'all have diapers? We'll get them connected. I'll get their zip code, and I can either get resources such as diapers delivered to them, or if they don't feel comfortable disclosing their address for any number of reasons, they can go to, say, a library and pick them up themselves. So we really try to work with them, especially because we don't ask for any formal documentation. That's a safety measure, especially because we provide support to monolingual Spanish speakers. We want to make sure that they feel comfortable in where their information is going and how it's being shared. And so the slides stopped showing, but I have mine. Should I keep going? The slides got knocked off.
Yes, Alex, I'm resharing your presentation. Sorry, just give me 1 second.
Okay, yeah, no problem. Yeah, so we don't ask for any formal documentation. In the referral form, they can put any chosen name they'd like, right? That they prefer to be for us to refer to them as. We keep all of our referral information is confidential, HIPAA compliant. If we do decide to work with for example, I have a client right now who is working with a psychiatrist, and she was referred to me by her psychiatrist, and we got full consent for me to work alongside the psychiatrist and kind of meet her where she's at. So we are open to work with clinicians if that's something that makes sense for that specific client. Best referrals. So we have found that folks are, if you're pregnant or postpartum, you're tired, maybe have, pregnancy brain fog or whatever it may be, sometimes reaching out to us may be a barrier. So we have found that when they are referred directly to us and we reach out to the client, they're more responsive. And the best referral, meaning what's most helpful for us as case managers, as peer supporters, is to provide the context of the client. So what are they looking for? Any information that will be helpful when we reach out to them. We say the more information when we reach out, the better. So we're not going in blind, and we can, go in prepared with some referrals already on hand. Preferred language. As of now, we provide support in 2 languages, English and Spanish. Any other types of needs that may be relevant to the client. So common barriers that we see, we've heard this already in our time together today, but stigma, negative experiences with the medical system, mistrust, long wait times, logistics, financial strain, housing strain. Housing strain has been a very common theme amongst our clients lately. So next, please. Next slide. So how Sonatana is different. As I mentioned, we're not a clinical support. We are a peer support model. So our entire team and our entire organization has lived experience with perinatal mood or anxiety disorder or mental health challenges during the perinatal period. So we're coming from lived experience. We are flexible. We have clients who've been with us for 3 years since we launched our program, and we have folks who kind of pop in when they need something, right? We don't have any stipulation on how people join our program. We just want to make sure that people are being seen, are being heard, and have the things that they need to have not just a healthy pregnancy, but a joyful one, right? I think that often gets lost when we're talking about pregnancy is we all deserve healthy, joyful journeys in our building our family. So we focus on connection, stabilization, navigation. As I mentioned, housing is a big concern with a few of our clients right now. Being pregnant and looking for housing resources has been a challenge. I would love, if you have any of those, please, I would love to see them because we're trying to build up that resource list currently. Integrated support across mental health, social needs, and community care. Folks sometimes, again, they don't trust the medical industrial complex, but they really love to lean into community meetups or mommy walks or dad meetups. And so we really try to meet them according to what is culturally congruent for where they're at in their, in this journey. Low barrier entry, as I mentioned, no formal documentation. They can just call or text us, or they can email us, or they can fill out a referral form. Next slide. This is one of our 2 current support groups that we offer. This is an affinity space led by our 2 lovely facilitators, Dominique and Summer. It's a affinity space for Black mamas who've had a baby in the NICU. They meet virtually. On Thursdays, they try to do in-person meetups every few months. And I know folks have really enjoyed that. The QR code is there. Again, this will be shared after the presentation. And this support group has been around for about 2.5 years now. And it's free. I don't know if I said this, everything is free. All this is free. Next slide. Thank you. Our second group is your queer parenting journey. This is also an affinity space for queer and trans parents. Also virtual. This is open to anyone who identifies as under the queer umbrella. It's open to folks in LA County. So all of our program is LA County focused, but we do work with folks who live near LA County and adjacent areas, just because we know there are a lot of resource deserts outside of LA County. So we try to be mindful of that and to help and support in any way that we can. And this is where we see that a lot. People who are a little bit outside of LA County and don't have, or a queer person who is pregnant and they don't have community, we allow them to join. We're pretty flexible on that. Next slide, please. This is a resource that we have specifically, again, for a provider or a caregiver, community care worker. If you are looking to better support queer and trans parents, we have this free resource available to download. Next, please. And just some things that we learned. So I feel like sometimes, when we're designing our programs, it's like, oh, we have to hit all these things. We have to do this. We have to make it real flashy. But at the end of the day, what we've learned, back to the basics, when people feel seen and understood, the nervous system begins to settle. They just want someone to see them, right? And so we really try to lean into that by being very flexible, low barrier to entry. We have a lot of folks, I think this is maybe we shouldn't be as flexible in this, but we have a lot of folks who kind of cancel last minute and then need to reschedule because, morning sickness or just life happens. We try to work with them and understand why folks are missing instead of, a lot of programs that they've shared with us is, I was late twice and they took me out of the program, which is like really devastating because it's like these folks are really vulnerable and putting in a lot of effort. And so, we really try to meet folks where they're at and understand where they're coming from. And as I had mentioned, connection itself is regulating. Peer spaces really allow folks to witness each other's resilience and creativity and kind of, again, integrate the joy that could exist in this process that doesn't often get uplifted. We teach a lot of sensory, somatic grounding practices. We teach sensory tools because oftentimes, if language is too difficult, sometimes folks can, maybe they can't talk, but they can focus on their breathing, right? Maybe they can't talk, but they can get up and do a little bit of movement, and we can guide them through that on the phone or via Zoom. And that's something that folks have really expressed an interest in lately. So. Next slide. Great. So as I mentioned, this was just our Sana program, and at Maternal Mental Health Now, we offer a lot of trainings and other types of wellness events for providers. If you scan this, you'll get a lot of information about the other things that we do. And this is all available on our website, but this just goes straight to your drive so you can share it with folks in your network. And I believe that's it. So thank y'all so much. I'm happy to answer any questions. I hope I was good on my time. And yeah, thank you. I'll end it there.
Wow. I'm just going to say wow because I'm really in awe of everything that each of our panelists shared about the resources that they offer and the supports that they provide to our parents in our community. And really what I'm hearing is that there are a lot of interim supports for families that, they may need more in-depth mental health services. And while they're waiting for them, there are other programs that provide coaching, like Bright Life Kids, or support groups like Jewish Family Services, New Parents Connect, or Maternal Mental Health Now, Santa program. So really just want to applaud all of our panelists for sharing resources on your services. And I have some questions, and we're also, please feel free to drop your questions in the chat, the Q&A, not the chat, the Q&A preferably, so that we can get them more quickly. But I want to start by just with one quick clarification question. This was for Melanie. Are the support groups you mentioned, are those all online or any of them in person?
They are all online,
Okay.
which is lower barrier for all of LA County, but makes it harder for people to meet in person
Okay.
less frequently.
Got it. Okay. Thank you for that clarification. And some of you already, answered this question, but what kind of walk us through what it looks like when when a home visitor refers clients to your programs. What would a warm handoff to your organization look like? And I'm going to open this up to anyone who feels like, oh, we didn't quite answer this, or let me tackle this question.
I'll go ahead and answer.
Thank you.
Oh, if we get a warm handoff, what that looks like is we connect the parent caregiver with a family partner. Family partner then goes and does what is called a navigation call, which is really a series of questions to trying to get an idea of what it is that the parent is concerned about regarding their child's development. Once they ask questions like, are you already receiving services, or what are your concerns? What are you hoping for? A little bit of background on all of that. Once that is all established, then the family partner lets the family know what the resources are that they should be put in contact with, whether it's a regional center for an assessment evaluation. If it's a child that's very young, home visiting is definitely always something that we refer to family to. It could be advocacy. The child might already be in school and might need an IEP or something like that. So it depends on what it is that the family needs. They go over all of those resources, and then after the call, or before the call ends, they schedule a follow-up. So the family will receive a call in about a month just to make sure that sometimes the wait lists are lengthy. And so about a month or so takes so that the family can link with that agency, hopefully has received a service, or at least has done an evaluation or some sort of assessment or intake by then. After the call, they do receive an email with kind of a recap of the whole conversation and a listing of all of the resources that were given to them verbally over. And then if the family on the follow-up, if the family expresses that there was some sort of barrier, then we work with them to try to get past that barrier. If they need additional resources, we provide additional resources, and anything else the family needs. And then they'll let us know whether they would like an additional follow-up call, or if they can kind of take it from there. So that's kind of what it looks like through working with Home Grow.
Thank you.
Marlene, can I take this one very briefly?
Absolutely.
For us, just to contact us, and people who are parents who contact us will get a call back within 24 to 48 hours from one of our program staff, our clinician usually, and then have a brief touching in, and then either immediately move into an intake, an enrollment, or be placed on a wait list, in which case we will communicate with them and give them other resources. And then they'll join a group as soon as one is available. We pull therapy clients out of our group, so we don't they take therapy referrals from the outside, but all of our services are led by clinicians in our mental health services. And lastly, I'll say if people need a higher level of care, we will navigate them. We have limited capacity, so we can't navigate every single person. We would go to DMH for that, but it's going to depend on what people have in terms of insurance. We'll talk about that more. I think there's a navigation portion of your questions. Is that correct, that down the line we're going to talk about how we get people to other resources?
Yes, definitely.
Okay, great.
I would love for DMH to kind of answer this question, because I know it feels a little bit overwhelming. Like, I'm calling into the Department of Mental Health for the county, and what does that look like? And what is that going to look like for my client as I try to help her and navigate services?
I can start off with that, and then if Alicia or Dr. Espinosa want to add in. But so in terms of doing a warm handoff, it's certainly possible for the family or the caregiver to call themselves. We will ask for certain demographic information, if there is medical, etc. But if it certainly makes sense, and we often have family members, consumers who call in with a provider as well. So in this respect, a home visitor can also be on the line, and they can help to provide that support. And the only reason why I would say that the whoever the person is that needs the additional support or the services needs to be on the line, just because our agents will ask questions that the home visitor may or may not have the answer to. And so that could potentially slow down the process. But that's certainly something that is possible, that a home visitor can call into the Access helpline to, request whether it's a referral. If it's a crisis, certainly that can also be done. Additionally, more specifically related to like a crisis, for instance, a home visitor can call in and say, I have concerns about this individual that I'm working with, and we can still send out a team. So in that respect, the consumer or the potential client doesn't necessarily need to be on the phone. It can be a home visitor calling in, for instance, requesting an assessment out in the field or in the home, wherever the person is. So that's a little bit about sort of the initial entry. And again, calling in, there's a variety of different sort of resources that are available to help from. So let's say somebody calls in and they want a referral to one of our contracted or directly operated clinics. Everything is sort of done on the back end on our end. We then provide the information for the clinic that the client has been referred to, and also let them know that they should be receiving a call from that provider directly within 3 days. And if they do not hear, that's why we provide the contact information so they can call to follow up as well. Want to make sure that people get that information fairly early on. And perhaps Alicia or Dr. Espinosa can talk a little bit about, in terms of the perinatal mental health services.
Thank you. It pretty much runs the same. So if you or the client decides to call the clinic directly, usually there is individuals that maybe officer of the day or intake of the day, and they will basically triage the client, provide them with an appointment and resources. So that's the only difference I would say, compared to calling the access line, that you talk to someone at the clinic and you kind of get the appointment, compared to a lot of times when you call the access. Sometimes some clinics do provide access, I think, with appointments or have to schedule something. But I would say that's just like the only difference. But how it works if the client decides to use like the directory that I showed. If you decide to use the directory and call the clinic, the client will get an appointment.
Yeah, that is a good point, Alicia. I'm glad you brought that up because, the access center does act a little bit as sort of the middle person, right? But if a client or again a home visitor has the direct contact information for one of our clinics, they're gonna have more access to what their schedule looks like, and they can possibly even do a walk-in. So that's certainly an option to call the clinic directly.
So it sounds like if there's not a crisis, maybe calling the clinic directly is the best move to
That
get.
could work.
Okay.
Again, just to be able to get an appointment a lot quicker.
And what type of information does the home visitor need to have on hand, or the client need to have on hand in order to get that appointment? Do they need their insurance information? What's required?
Yeah, so the insurance information will be needed, certainly to verify that. Sometimes too, there are screeners that need to be done, but it is possible. Our screeners, we have sort of the caller themselves providing the information, but we have somebody, the screener also calling on behalf of. So definitely insurance information, first and last name, date of birth, pretty basic information like that. And then the referral need or the resource that they might need.
I just want to add, typically if you call directly to the clinic, it is a little bit more questions. They'll talk a little bit or get more into like some of the symptoms that the individual is experiencing. That way they kind of know on the back end which program they'll match the individual to.
That's helpful. Thank you. Um, I want to move to a question about supporting clients that have, they may be undocumented, their immigration status may be in question, and we know that this provokes, some anxiety for families. They may really need the mental health supports, but they're scared. And I know that some of your services, questions are asked. They don't have to provide a lot of information. And so we really appreciate hearing about those resources for clients. But what are some ways that you would help families access services if if they are not documented? And I'm leaving this a little open. I know that Bright Life Kids has kind of addressed this a little bit, and as well as um, but I'd like to hear a little more from the other organizations.
I'm just going to say that we don't ask in either program. It's not a barrier at all. It's really a question of language capacity for us. So Raising Baby has Spanish monolingual, and we don't. And New Parents Connect, but otherwise it's irrelevant. We don't share information with anybody.
Okay, thank you.
I'm gonna add as well, and I know we already said we don't ask for a lot of personal information at Bright Life Kids, but we also don't share the information, and what's given to us is a name and an email address, right? So it's very limited information that the families share with us. They're not going anywhere. It's all virtual, right? So they're not also exposing themselves if they're concerned about that. So it's really it's a lot of privacy using our services. I just want to reinforce that. Thank you.
What I can say for DMH2 is that is not something that is asked about specifically, and there is also options for telemental health services as well if the families feel unsafe going in person. So that's certainly something that can be accommodated as well.
Thank you. If families don't have insurance or Medi-Cal, I think that I heard from Bright Life Kids, they can access your services. I believe maternal mental health, now they can access your services. And it sounds like the same with Jewish Family Services, right? For other providers, what happens if someone does not have the insurance or Medi-Cal?
So with Help Me Grow, if you don't have insurance or Medi-Cal, because the programs that we do refer them to usually do need something. We refer them to CHOI, which is which then will help them, apply for insurance. And same thing for housing or immigration services or anything like that, even though it's out of the scope of what we actually do. The minute we get a call and the family's telling us during that navigation that they need, food or housing or immigration, anything like that, we kind of focus on that. And it's, that comes first, and making sure that the family's stable in that way. And then we then provide the other, what they actually called for. But we try to help them in all.
Thank you.
Sorry, and really quickly, CHOI is a program part of the Department of Public Health, and it's aimed at increasing health coverage and access for children and families.
Thank you. Lizeth, would you mind dropping information into the chat about CHOI?
Yes.
Like, yeah, the basic. Yeah, thank you so much. Okay. And I want to talk about, I think I'm hearing that there are a lot of resources. So when there are waiting lists for services, it sounds like there are other resources available for families. Coaching, support groups. Can someone I mean, what do these resources and services provide for families when they're really struggling? And we know that there's a shortage of mental health providers in our county. So how would you help families that cannot, that need the services but can't access them right away? Melanie, I saw you nodding, so I'm going to have
this is a
you.
big question, and it ties into kind of the service gaps because we all have such unique offerings, but then, they still exist in certain niches where some barriers are there and some aren't. I think that for us, we refer to Postpartum Support International, but those are open groups. Those aren't closed groups. So they aren't exactly, but they do offer all languages and they're available all the time. So they're a little bit different from what we offer. And so there kind of is and there isn't. There are things, there isn't, we can't offer the families everything that they need. And I know another one of the questions that comes up is around what happens if people need more care, higher levels of care, and how we as a community put that together, utilizing each other. The people that are on this panel, we all know each other and other organizations because we know each of us has something, and then there are going to be things we don't have and things that we can use for supports, but might not be exactly a fit. I don't know if everybody else agrees with that, but yeah. So there are support groups, but there aren't a million support groups. But then there's this or that, or some people have this kind of insurance, or some people don't have insurance, or some people don't meet income eligibility levels. They're too high, or they don't, there's all of these sort of different ins and outs. And I guess that's where we come in as navigators. It's sort of our duty to know and to communicate with each other and to create, a web for our clients, have knowledge of what is out there.
Thank you. What do you see as barriers or challenges for families to accepting mental health services? And are there misconceptions that you can help dispel for families? And I think everyone said that they would be able to answer this question. So I'm just going to toss it out there to any of our panelists who want to start us off with this response.
I can start. Oh, okay.
No, go ahead.
I would say something that specifically in the monolingual Spanish speaking folks who utilize our programs, one of the biggest trends I've seen in terms of barriers is folks are new to this country, right? Or they're new to the city. And so a lot of the initial support that I have done is just like teaching folks about the transportation system, teaching them how things work in LA, teaching them what to expect, like what's the typical process of going to a food bank, right? It's just all this huge mystery of the unknown. And even, if I am doing a lot of things that we do is call a bunch of clinics and try and get our folks on wait lists because oftentimes therapists don't respond to the client when they're reaching out. They don't respond to us. So it's just kind of hounding us, hounding these clinics and asking, if are you not responding because there's no space? Are you not responding because you're full, you don't take this insurance anymore? Like just trying to understand what's going on as why folks aren't being responsive. And we take that barrier off the client and we take it on ourselves so they can focus on on other things related to their well-being. um, but yeah, I think just like not having community, a lot of folks don't have family, especially with, the immigration, ICE raids, and just hate crimes going on, is it gets more and more insular as time goes on. So how can you kind of get beyond that barrier? And, this one person who I work with, she used to love going to the park and like doing the asala or barbecues and like going out and meeting people, events from her church. And now she doesn't have that. So a big barrier is how can we find a replacement for that type of community, right? And oftentimes it's not a clinical support, but if the community support that she is most interested in is no longer a safe option, then what can we replace that with or look towards instead? Um, so I think just like community is a big barrier as well. Not having community to like bounce ideas off of or heal together with, right? A lot of cultures don't heal one-on-one with folks, they heal in groups. But if the group is no longer available, then what do you do, right? It's just a lot of creativity. You really got to be creative.
Adriana, can you address what those when you're working with a family and you see that they need more mental health resources, how does that work? How do you provide those referrals?
Thank you, Marlene, for asking that. So at Bright Life Kids, we have an amazing team of, we call them coach specialists, and they are our care coordination team. They have the same credentials that our coaches. So when they talk to the family, they're trying to get the whole picture, right? Understand the mental needs they have or the community resources they need. And once talking with the families and realizing what's necessary, we use Find Help. Find Help is a platform, and that's where our care coordination team go to find the resources. And then we have two options once we make referrals. We can make a referral for something that we call affiliate network partners. And these are partners for mental health services that have been vetted by our clinical team. Most of them accept medical patients and patients or have a sliding scale, something fee that our patients can use, but we try to find the services that do accept medical. And the care coordination team will make the referral for that partner first, for the affiliate network partner first. If we don't have one partner that matches the needs of that client, using Find Help, that's this platform where we have a lot of other resources, our care coordination team will find a resource for the family. We follow up 3 times after a referral is made, right? Just to make sure that the family received the referral. And if it is sent to an affiliate network partner, we have what is closed looped. That means that not only we send the referral out, but we got a confirmation that the client got the services that they needed. So we're very proud that we can do that for the family. So there is not a closed door. You come to us, whatever you need, you can offer you in-house, or we are going to make a referral for you outside our services. Thank you for asking.
Thank you. Another question related to home visitors referring their clients to your programs. How does a home visitor know when a family is a good fit for your program and should be referred to your program?
I can go. I just say refer
Yes.
anyone to us. That if you're not sure if they're good for coaching or not, right? Or if they need more services, mental health, send us our way or a coach. They will have a first session with your family. And if it's not the best for coaching, as we talked before, we can refer them out. So we're always here for your families.
And that's an open question for others as well.
Same thing for Help Me Grow. If you have any concern or any question about child's development that a family might have, they can just, give us a call and we will, we'll figure it out together.
Yeah, agreed. It's best just to send people over with some awareness of the criteria of perinatal, pregnancy through 1 year for us, and then better to send than not.
Would someone from DMH be able to address that question as well?
I can address that in how it shows up when I was in the child clinics. And I think that one of the things is the family knowing or the home visitor knowing what the program does, because sometimes they were trying to get them into mental health services and regional center, but they were calling us thinking we were regional center, and then we're calling regional center thinking they were DMH. So I think that's something that might be really helpful that I know would also help the families is one, knowing which program you're calling. And if you don't, asking who you're speaking to about what services are being delivered, because I can only speak to my old clinic, and the officer of the day was well versed in both DMH and regional center, as she had actually worked at Lanterman before. So she was able to distinguish what services and really point them in the right direction. However, I can't say that all officers of the day are going to have that. So maybe asking those questions, like just clarifying what services do you deliver, that can really help a family getting in through the door.
And
Thank
I
you.
can add to that in calling into the Access Helpline, again, because there's so many different clinics and resources, our agents will ask questions to try to assist in finding the best resource or the best clinic. So I would say just calling in into the helpline, providing a description of what might be going on, and our agents can then let them know, well, we have these programs and these clinics, and we also try to address some of the sort of distance and transportation barriers, and that our provider directory and the way that we train our agents is to be able to find services that are close to or in the community of the caller, because it increases the chances of them following through, right, and making their appointments, and that's a huge thing. I mean, no shows because of life and all that is going on for these families. So we try to make it so that it's in their community, in their area as well.
And are any of the DMH services provided online, like telemedicine, or is it all?
There are options for telemental health as well, and that's something that callers can inquire about. And even, for instance, if let's say they've already been connected to a clinic, they can also ask their provider directly, about telemental health if things change over the course of their time and services. When, say, if they encounter transportation difficulties, can we do sort of more telemental health or telephone check-ins while they get situated?
I do want to add that I know for some of the clinics, the first initial assessment, sometimes they require it to be in person. But then afterwards, like Dr. Chavez was saying, you could kind of have that conversation about doing telemedicine, as well as for some clinics, depending on the severity of the case, too, they require it to be in person or they kind of refer it to a higher level program.
And so really quickly, related to sort of a higher level of need or services, we also do provide field-based services. So many of our programs go into the homes of the clients, for instance. But of course, keeping in mind if there are privacy concerns, then that can also be addressed with the provider as well.
Thank you. I'm going to just quickly check the Q&A. Looks like, oh, we don't have a lot. Okay, let's see here. They're being answered, which is good. Yes, I think most of these are about will resources be shared? And absolutely, all the resources will be shared after the panel. So Monica said she doesn't see the Q&A for telehealth. Okay, so for DMH telehealth mental health services, do they require insurance? Is the question.
So typically, I mean, our services are heavily based in our consumers having Medi-Cal. That being said, there are some programs and some clinics that may have like grant funding, right, where they wouldn't necessarily ask about that. So again, I would encourage call, ask, we'll still get connected. Nobody's going to get turned away. And certainly not going to get asked about like immigration status or, they'll ask about insurance status, but that's not going to prevent an agent from still connecting the consumer to services because, again, there are some clinics that may have other alternative funding that doesn't require Medi-Cal or insurance.
And I know kind of sticking with that theme of questions about immigration status, what information would be shared with other agencies? So how do clients know if where their Medi-Cal information is being shared if they're sharing with you?
So for DMH, for instance, I mean that information will verify it on our end, but we don't share that information. The clinic will then ask that information directly from the client. And again, because of HIPAA for a lot of our providers, we cannot share information without the consent of the consumer or the client. The exceptions to that are, again, sort of subpoenas and things like that, but outside of that, information isn't shared.
Just to piggyback off of what Dr. Chavez was saying, so if the client does contact Access and they may ask about the insurance when they go to their appointment, they will meet with the financial person. That's when they give them that information. So even between Access and the clinic, that information isn't readily shared as well. So that's why when they go to the clinic, we request that you have your ID, insurance cards, and different things like that, because that is handled at that specific clinic. And then say a client moves to a different clinic, they'll have to go to that clinic and give that same information as well.
Thank you. And I know several of you shared what your wait times are or when clients will get a call back for services. What are some options, some things that families can do while they're waiting?
For us, I would say postpartum support international groups are a place we would send them. Also, we would utilize Sana Sana if appropriate for peer support. Of course, we would refer to our own home visiting program, but only if that's indicated. Not everybody necessarily wants that, or potentially to Bright Life, because people are usually waiting for groups. We will try to access mental health for people if we can't give it to them or if they're waiting for it. We will reach out to DMH. The maternal mental health champions are really important for us in this regard. So, and I think just continuing with the training about perinatal mental health for home visitors and for everybody involved so that they can recognize it when they see it. And people get calls within a day or two, but it's true, we might not have what they need right away. We find with pregnancy support that we often won't have enough people for a group. And it would be really interesting to see what other groups are out there for people. I don't always know where to find that.
Thank you. Okay, here's a question. Thank you, Steve. Steve from LA Best Babies Network shared a list of various groups on the Stronger Families blog, and there's a whole section on mental health support. And Steve shared the link there in the webinar chat, so please feel free to go there. And I know that they periodically add and update that list. So the Stronger Families blog is a great resource for not just mental health information, but all sorts of information for our home visiting providers. I do have some more questions, but I think at this point we have like 13 minutes left, and I want to really open this up to the panelists. If there's anything that you want to add or share that maybe one of the other presenters made you think about something that you wanted to bring up, I'm going to open this up now to the panelists.
I just want to say thank you for all the panelists, because I think that was, and you all that organized that, was so beautifully put it together, because I think each one here really complements each other. And if I cannot do this, I know Melanie will step in, or Dr. Chavez' department will step in, right? Dr. Espinosa. So we're all together here working for this family. So I think it was really well thought how you brought us together. And sorry, I didn't see, I see Alex now on my screen, and Lisette, I'm sorry, Diane. So we're all serving the same families, right? With the same purpose, is that to make them safe, to make them feel welcome, and in a very hard, right? As immigrants, we all suffer with what's happening. We're all impacted, and I'm just grateful. So I just want to express my love and to all the work that's being done and everything that you put together for us to come together. Thank you.
Thank you, Adriana.
I think on our end with Help Me Grow, I want to emphasize specifically to service providers, right? Let us help you as well. I know we are here for families, but if we can also take away some part of that small piece of case management so you can focus more on the individual components, we're also here for you. And there is no double dip in our instance. Our services don't require any insurance. So we can concurrently work together to support the family you're working with.
Thank you, Lisa. Okay, I'm seeing lots of hearts, lots of love. We appreciate that. Let me check the Q&A. Does anyone have any of our audience members, feel free to drop questions in the chat about eligibility, resources, anything that you feel like there's no bad question or wrong question.
have a question. Because Help Me Grow deals primarily with like families with children with delays or special needs. I'm curious if the other programs here have encountered that where that's part of the support that they offer is to families specifically with children with special needs. There's already such a stigma for mental health, well, even a stigma with children with special needs, and that's going back to that question that you had earlier about the barriers. That is definitely one of the barriers because these children present with behaviors already that families don't necessarily seek out mental health because they don't know that if it's separate. They kind of take like the behaviors and everything as it comes as a package and it all comes together and they just have to deal with it and don't necessarily know that, you know, this is going to cause burnout or this is going to be overwhelming and that the parents can reach out and search for assistance in that way with support groups and things of that nature. But I'm just curious if that's something that mental health program ever comes across. I would think Bright Life Kids does because we refer a lot of families to Bright Life Kids.
Thank you.
We send them to Bright Life Kids.
Thank you, Diane. Yes, you all send it. We have a beautiful new flyer to support the families with kids on the spectrum. I'm happy to send all flyers digitally or printed to any of our parents. We have coaches that specialize in supporting the family. So I appreciate your referrals. Thank you.
I just want to say, Diana, that's such. Oh, go ahead.
Thank you, Melanie. For Adriana, if you would like to share those flyers with us, we can actually share it through our distribution system. So the providers who have signed up for our listserv can share that with their families and their clinics and get it out further if it's like an open group.
Thank you. It is, and I'll do that. I'm very grateful. Thank you. Appreciate Dr. Espinosa.
I was just going to say, what a great question, Diana. Thank you so much for asking it. It's definitely such a need to find the mental health support and the support group specifically for parents who are going through that. We have a couple of them, especially one for parents of adults. We have one at JFS for parents of adults with special needs, but always looking for that. And you have groups, right, over at Help Me Grow?
We have parent cafes where, because they're all by different spas, so they're not,
Right.
It's not just one. But we do have parent cafes where we encourage parents to come and, you know, just, it's very informal. It's just getting together and networking with one another, sharing their experiences, their stories. Ever since the ice raids, that kind of like was difficult. So we've kind of gone virtual. And so now so now we're kind of starting them up again. So yeah, we do have the parent cafes that we encourage parents to go to, but the getting them on virtual, it's been a little difficult technology wise. So they're not always able to log on. And so there's been difficulties with that. But we do have them also on site in certain spas. I can share our flyers and it's got a QR code and then it'll give you the dates and everything when they're being held in case anybody needs those.
Just realized I was talking with my microphone muted. Anna or Laurel, do you have any other questions that you want to pose or anything that you think, oh, we missed out on this?
I don't think so. I think just wanted to thank everyone for joining and volunteering your time and spending the morning with us. It was amazing to see how you all support each other and what programs are familiar with one another, and just all the wealth of knowledge that you all shared. That was really helpful, and I know our staff really benefited from it. So again, thank you so much for joining us today.
Thank
No,
For
you.
having us.
Thank you so much. What a
And
wonderful
again,
opportunity.
we will be sharing all of the resources, and the webinar was recorded and will be available on LABBN's website